All right.
Go.
Should I just do it?
Let's go.
All right, Dean, welcome back to Dose of Health.
Hey, Abby, how are you?
I'm good, man. I'm good. You're the first guy that I had to bring back. Usually I was like, I'm gonna wait for a few episodes before people come back. But what we did last time on AI in healthcare, I think it hit the nerves with so many people, so we had to run it back.
Yeah, thanks, man. Appreciate that. It was super fun, super interesting. So yeah, good to be back.
Nice one, bro. So for audience, what we're doing right now is after the feedback that I got from mine and Dean's podcast episode on AI, we found that we had struck a nerve and a lot of people want to talk about it, but don't really know how. So I went back to Dean and I said that, bro, I think we should do a series of episodes about AI, because what we did last time was we touched so many big topics, machine learning, neural networks, NLP's capabilities. Like it was just kind of like snippets, but we didn't really delve into one topic in a big way, or try and figure out that how would that impact patients or us as healthcare professionals or the government. So I thought, let's just try and do these series of episodes. Who knows how many episodes it's going to be. Let's just say 5 for now. And try and give it a bit of a structure. So I think for your new audience, Dean, do you want to kind of just reintroduce yourself? Like, who are you and what got you involved into AI?
Yeah, sure. So I'm Deen Somally. I'm a pharmacist by background. So I worked across a bunch of different hospitals in London for about 6 years, and then made a shift into project management. So right now I'm a project manager working for NHS England. And yeah, my big interest just outside of work is disruptive technology. Like I'm addicted to it. So it's something that I've just been exploring massively. And yeah, that's where my head's been in like for the last 2 years. And I'm thinking about how can we connect the two? How can we explore healthcare and AI together? Because it's huge. And I think me and you, Abby, we're both in the same boat where we can see something powerful is going to happen in the future. And I was trying to get some vision as to how that could look like.
Of course. So let's just dive into it. The topic that we today decided was going to be around cancer and around cancer detection. And the first section is what we called as AI News Pulse. So let me see if I can share my screen with you, and let me know if you can see it, Dean. Can you see this?
Yeah, I can.
Yeah. Guardian came out with this article last week, and it basically speaks about ovarian cancer blood test, and how it can now detect the disease early. Did you have a look into this, Steve?
Yeah, I did. It's powerful. Yeah. So
It's
yeah,
it's yeah. Go on.
just reading the article here, it says like more than 300,000 women, mostly over the age of 50, are diagnosed worldwide with ovarian cancer each year. So, um, it's a big problem. And now it's, with this kind of news, it's AI has been able to shed some light into how we can detect it earlier.
Let me give you some statistics about ovarian cancer, and I actually didn't even know. In the UK, about 7,500 women are diagnosed with ovarian cancer every year, and 4,500, oh, actually, 4,100 women die annually from ovarian cancer in the UK, and it is the sixth most common cancer in women and the deadliest of the gynecological cancers. And if you look at the global statistics, it's 300,000 new cases with 185,000 deaths worldwide each year. And that's according to WHO. So, I mean, it's no surprise that if you could find a technique by which you can reduce the number of deaths by, I mean, God knows, 10%, 20%, even that tiny shift can actually save so many lives. And it looks like this technique has used AI to come up with this test that can spot ovarian cancers early. What do you think could be the impact of something like that, let's just say within the NHS?
Yeah, of course, it's powerful. One thing, Abby, is can you zoom in on where you're currently sharing your screen? Because
Yeah.
yeah, that's great. That's perfect. Yeah, I mean, I was reading this thinking this is incredible. I actually can't see a downside. Like, can you
Mm.
see something somewhere here that could be um, like a negative of introducing this?
Well, my clinical brain for something like that, something that is so novel, almost goes into like what happens when a system malfunctions, like the governance side of that. Automatically things along those lines. That what would happen if it's actually giving wrong results, and next thing you know is that somebody's getting treatment for something that they don't have. So
Yeah,
the question right back to you would be that should the results be then verified by a human doctor? What would you say to that?
yeah, I think so. Yeah, like ovarian cancer diagnosis is not something that I've had experience working in before, but my immediate thought would be what's currently happening? What's the current test situation? Are they currently um are current tests being verified by a human doctor?
Yes.
Okay, yeah. I, th- if you scroll down also near the end,
Yeah.
it talks about how the test showed 92% accuracy at all stages, 88% accuracy in early stages.
Yeah.
What I'm thinking is, how does that compare to the current gold standard of testing? So a test for the test, in experiments comparing this test with the current gold standard is the one factor that I'm thinking about from the clinical perspective about how to introduce this. If it's going to be successful to introduce this or not. Because from the off, it looks like it's already like an incredible breakthrough. The only other thing that I'm thinking of is with my like NHS England head on, because we're where I'm at now is not on the front lines, it's more on the back lines, thinking about it from a bigger perspective. And what this test doesn't talk about is cost. How much does it cost? Because
Mm.
for sure, like us, like as pharmacists and clinicians, and all patients would be like, if the test is better, for sure, like we'll introduce it in. But then from the national perspective, it depends, how much does it cost? If it's cheaper, then 100%. But if it's more expensive, it's about being able to justify the cost for it being more expensive compared to how much better it is. Because if it's way too expensive, then it would actually be better overall for the entire population to have a less accurate test that's like 10x cheaper, if you know what I mean.
Of course, of course. I think cost will definitely play a role in it. What I found out that with ovarian cancer, the survival depends on how early you diagnose it. So if it's caught early, then 5 year survival is greater than 90%. But if it's caught late, it actually drops to less than 30%.
Okay. Yeah.
So,
What's meant by late? How late is late?
well,
After a
I
year?
would imagine. Well, I would imagine it would be stages, right? Stage one, stage two, stage three. But I can double check. But that's what I think. If you detect it at an early stage, and then your survival is greater than 90%. But if it's like late stage, then it actually
Yeah.
reduces
So just drop.
30%. So
Yeah, it just drops
so
massively.
so if you do have some kind of a screening protocol that is actually giving you 93% accuracy or 91%, whatever you said, and it could eventually become part of a routine health check for at-risk groups. It could be people who have family history. If there are post-menopausal women have an issue, high risk of ovarian cancer, or there is something called BRCA gene carriers. These people can actually get. They're at high risk as well. So imagine if you just target that group first. You don't need to go out like and say entire world can get it. Like these people will be immediately at high risk. Bring them into some kind of a program, and see what the outcomes are before it gets rolled out for routine screening.
Yeah, I mean, there's a lot of different programs happening. Yeah, so it depends exactly what it is. Where it's possible to be able to expand out into what you were saying. But yeah, you touched on a couple of things that I found interesting.
Go on.
Technology is deflationary. That's the first thing. Technology is deflationary, and prevention is more important than cure. And so I think those are two facts to me. They're not opinions. They're two facts. Technology is deflationary, and prevention is better than cure. In reality, technology should be deflationary, but it depends on like market dynamics. Some companies, if they're the only player in the game, they could raise the cost of and the other thing is it then would have a knock-on effect as to if something is expensive, you can't roll it out for preventatory means because it would be too expensive to roll it out for tons of people. So then it would change how it's used by the NHS to one that it can only be used for a cure. So looking at this ovarian blood cancer test, it's super interesting because if it is, if things are cheaper, it means that we will be able to open it up to become more preventatory. So what that could mean is, the NHS could be like, okay, we found a great test that's very accurate and it's very cheap. So what it means is we will be able to give every adult over a certain age, let's say it's 55, 65, an annual cancer blood screen by 2035. And it would mean that the 5-year survival rate would be above 90%. So we could set a clear goal, a clear target to work towards.
Of course. Not only that, like how much money are we going to save on treatment?
Yeah, exactly.
Right?
So
I mean, these oncology drugs can actually cost like thousands. And imagine the aftercare, imagine the appointment, imagine the hospital visits. So if you can actually detect something early and AI could help us do this, it does sound like a no-brainer to me.
yeah, for sure.
Let's move on to the third topic, which we like to call deep dive topic of the day. And this is where we basically discuss one aspect of AI. And the topic I've chosen today is to just go extremely basic, and then talk about the capability types of AI. And I think people just think AI as in this one general term, but there are different levels to it, right? So we have a NI, artificial naive intelligence, we have a GI, artificial general intelligence, and we have a SI, artificial super intelligence. So I would like you to maybe have a go first, Dean, and talk about these different capability types. Like, what is it? What is the importance in healthcare? And why should we know about this?
Yeah, sure. AI itself is just super broad. I think let's start broad and then go into more like AI itself. It's a set of tools essentially for making computers behave intelligently. So that's what it is at the broadest level, trying to replicate human intelligence first and then just go beyond that. So being able to make decisions and solve problems as better as we can. And you said ANI is artificial naive intelligence. I have heard that before. What I like to refer to ANI as is narrow
Narrow,
intelligence,
yeah.
because the differentiator between artificial narrow intelligence and artificial general intelligence is that narrow intelligence just does one thing. Like
Yeah.
you think of how you could feed an AI CT scans, and then the one output is tumor diagnosis.
Yeah.
So that it's narrow. Whereas artificial general intelligence can do anything essentially. It can have any input in. That's how I like to differentiate it. Artificial narrow intelligence has one input in, one output. Artificial general intelligence has any input. So that's why when people talk about how we're not already at AGI, I feel like we are. When ChatGPT came out, That was kind of the point. We're at AGI. The only reason why people say that we're not already at AGI is because we have certain benchmark tests like ARC AGI, like ARC-AGI. That's a really popular benchmark test that um, it decides, it's essentially the test for if we have hit artificial general intelligence. And right now, the best AI right now, the best AI is Grok 4 from XAI, which has got 16%, which is so that's why people say we're not at AGI yet. But I think that's ASI personally, artificial super intelligence, where
Wow.
we go way beyond the capabilities of humans. So right now, like the best models that exist, we could say Grok 4 thinking, GPT-5 from OpenAI, and Gemini's 2.5. And all three of those are pretty much at human PhD level or above. So yeah,
I let me push back on that a little bit. We were going to talk about like ANI, AGI, ASI separately, but I think we have not really achieved AGI. And the way I look at AGI is a human level intelligence, right? A computer is able to do what we are supposed to do. So, for instance, me and you are pharmacists. So, technically speaking, there should be an AGI who's able to do a pharmacist level job, just like me and you would do. Now, the question is, can they do it right now? So I can feed a large language model HIV knowledge, everything that there is in the world, but can it be me right now in this day and age? And that's the question. Is it possible that a computer can be left alone in a clinic room and the patients can actually go in and out and come back as satisfied as they can? And I don't think we're there yet.
yeah, that's a good point. What you're touching on is AI agents. Like agents are a step further than where we're currently at. It's just emerging right now, and it's where the computer is actually able to complete tasks, but that's all within the confines of a computer. When you're talking about like actual clinics, being able to run a clinic and someone going in and coming out as satisfied as they were as if they spoke to a human, I think we're touching on the realms of going even further out as to what is the difference now between a human healthcare worker and a healthcare super intelligent AI. And yeah, I feel like
I think, okay, let me push back on that. So AI agents is fine, right? That is how we're going to bring the entire intelligence that we have created into real life so that patients can actually benefit from it. But here's the point. You can put a person who's got a lot of PhD experience and I mean, this might, we may get a bit of pushback. Well, I may get a bit of pushback, but a lot of people who hold PhD sometimes can actually do not so intelligent things, right? I mean, the PhD CVs don't necessarily reflect true expertise in real world, is what I'm saying. We all know people who actually, like consultants and doctors, for instance, right? Even though they're all consultants, their CV might look very similar, but in terms of the output you get from each doctor's is different, right?
very
There is one guy or one girl in every clinic where you're like, you know what, if it's a very difficult case, you must go to this person, right? But that person could actually be not very good in communication, could have an attitude, right? Like humans are just so diverse when it actually comes to what truly makes us as a healthcare professional, right? So even if, let's just say, you can actually bring agents in and you can just say that, look, you have all the super knowledge, but people come in, clinics get disrupted, telephone rings, prioritization, like to that level where you can effectively say, now we don't need to hire a pharmacist because my agent is going to take care of all of that. And that is what I would say AGI would be, like, a human level intelligence. So
I
that's
see.
why, yeah, that's why I feel like you you can say in terms of knowledge, but in terms of like practicality, I'm not sure if AGI is here.
Yeah, I see what you're saying. I mean, that's a very valid point. I would say that what's the point of a human even coming into the clinic? What's the point of a patient even coming into the clinic? Then is so they could just sit at home and do the clinic assessment, right? But we're not there yet, I guess. I don't know how often that happens with
We're
the.
not there yet. And I yeah, I mean, at least in practice, I think we're not there yet. And super intelligence. I mean, do you want to define super intelligence before we even like mention
Yeah, I mean,
before we even start talking about it?
I don't know if if there's an agreed on dictionary definition from everyone, but what I'd say it is intelligence that is way beyond human
A single
genius
human
level.
being combined, yeah.
Yeah,
So
it's essentially, yeah, like as smart as all geniuses on earth combined. But there's levels to it, it keeps going.
yeah, I mean surpassing human beings in all areas you could think of. So one,
Yeah,
I would think like a pharmacist that really knows human body inside out from top to bottom. I'm talking about a super intelligent pharmacist, ASI pharmacist. Like, this is a person who knows everything there is to know about a human body. He's as good, if not 100 times better than any neurology pharmacist, and kidney and liver and infectious diseases and bones and everything. And this person can actually communicate in every language there is in the world. And this person who is available to you 24 hours, 365 days a year, all it needs is compute and power, and actually has global data being fed into his brain or her brain constantly, and he is receiving and processing this information in real time and changing decisions in real time. So, for instance, like something happened in South Africa, and they found out that a major outbreak has happened, which has completely changed the course of how we treat a particular disease. This person knows it as it's happened, and he's changed his behavior. So it's like superhuman level thing, and then 10,000 times more. That's ASI.
yeah, I see that. That's definitely the vision for where I think everyone is building towards. It's interesting that you said he or she. That's
Yeah, yeah.
different levels. It's like, what are we even comfortable saying now? Like, I'm kind of saying it, but I feel like it's quite rude. But no, that's interesting. But yeah, like your example around, yeah, like say there's an outbreak that happens in Africa, and then it can update its knowledge in real time. Like say this super intelligence is in the UK, then it's a legal and regulatory hurdle that it needs to overcome, because can it start just giving out advice because it hasn't gone through the NHS or NICE? There's no guidelines that have been produced. So yeah, it's like a grey area that
I
will seem
think,
to arise.
yeah. I think, you know what, bro? The regulatory authorities are just not prepared for what's about to happen,
Yeah,
because
sorry, go ahead.
I mean, the way AI has come into the picture and the way it is actually getting better, I don't think our current existing systems are capable enough to regulate that in real time. MHRA, FDA, HO, just look at how long it takes them to come out with one guideline. By the time they go through appraisals and peer review and are open for consultation and then implementation and then dissemination, by that time, AI is 35 times much better.
Yeah,
That is the problem. And I think overall, what's going to happen is this is what I think, that if we don't catch up in real time, the trust in the healthcare system is actually going to go less and less and less, because already it is getting less and less and less, right? People are using it to be their therapist. People are using it for second opinions. People are using it for diagnosis. So it's happening whether it's regulated or not regulated.
yeah,
And if this technology keeps getting better and better, then I wonder what would be the functionality of FDA and MHRA in the first place.
yeah. That's a really good point. To feel like the whole reasons why those institutions and regulatory bodies were formed decades ago was because normal people just
Yeah,
couldn't get that kind of high quality information. And
yeah,
so we needed these trusted bodies
yeah.
to gather the information and filter it down. And so, yeah, that's interesting. Like, how are these regulatory bodies and national and global institutions going to function going forward? And it's interesting what you were saying around how, people on like us, members of the public, using um, AI is because we don't trust these bodies as much anymore. I think one factor is that. Another factor is just availability of the AI. It's just immediate and it's so, um, it's so easy to use and right at our fingertips. So that's another reason why, you know,
Exactly.
we would use it.
Exactly. Let
Right.
me give you an example, bro. This is a real example that happened to me yesterday. Well, 2 days ago. My neighbor rang me and actually said that she thinks her mother's got Lyme disease. They went on a holiday and they actually got tick bites.
No.
And what did they do? They went to ChatGPT and they clicked the photo, put it in there, and it says that it is suggestive of Lyme's disease. So what does she do? She basically goes to the urgent care center and she took the mother because she was quite elderly. And there she gets seen by a nurse, a specialist who is a prescriber. And the nurse, just by looking, said, "Oh, this is just an insect bite," and she was just going to give them, say, go home and buy hydrocortisone cream or some antihistamine and go. Now, this lady, she's already done the research, right? So she shows her the research to say, "Are you sure this is not Lyme's disease?" So to that, the nurse, I kid you not, she said, goes to Wikipedia, types in Google, goes to Wikipedia to see what does a tick bite look like. The ring fences and a spot, and then she's like, "Oh, it might be Lyme's disease." And then she's like, "Okay, so what are you going to do about it? Should you be ringing tropical medicine?" And so, based on that, the nurse then decides to ring the tropical medicine department and they get an appointment to be seen by an infectious disease doctor, and she gets started on doxycycline based on the advice of the tropical medicine people. And then the following day, they go to the tropical medicine doctors, they do all sorts of blood tests, antibody tests, and then said, "Finish the course, and we will let you know what the results was 7 days later." So here's a classic example of ChatGPT completely changing the course of a regulated area where the nurse was actually going to send them home saying, "Well, nothing's happened." Imagine that.
Incredible. That's incredible. Doxycycline is that first line for
Yes.
Lyme disease,
Yeah. I mean, yes.
antibiotic for Lyme disease.
I just want to put a disclaimer out there. We're not really diagnosing or treating, and please don't stop taking doxycycline without. But I'm just giving an example
Yeah, you
of
need a prescription anyway, right?
you need a prescription, facts, and also please don't just keep diagnosing yourself with ChatGPT. This is not what I am actually saying, but my whole point of bringing that up was when I heard the story, I was just fascinated by it. To say
Yeah,
that this person has no medical background, she has no clinical background, and she literally just put that on ChatGPT, and suddenly she had good talking points to actually talk to the nurse and in turn changed the complete course of how her mother was going to be treated.
yeah, that's incredible. So, do you know if it's actually is Lyme disease, or is it still in that 7 days where they're waiting to hear back?
I don't know, but the tropical medicines doctor actually said it could be Lyme disease. We will confirm it, but it looks like it. And then please don't stop taking the antibiotic.
Yeah, so that's powerful. That's powerful. Like there's like I don't blame the nurse either
Yes.
because like we've been there. Like there's like 10 people that you need to see in like 30 minutes, and it's a lot of high stress, high pressure. You need to make decisions under real time, but it points at another common cognitive bias that people have in clinical practice that we see all the time, where clinicians the database that we are operating with is essentially under frequency. How many times have we seen something like what we're looking at? What has it been most of the time? And then we use that as our statistical prior to decide what it's going to be, which is flawed. It's flawed. It's how how the human brain operates. And so, yeah, like having the AI behind that is it's revolutionary. And I can see that the way that this connects is that maybe we should trust the healthcare professionals to use the AI, because she essentially used Wikipedia, which is just to me it's just a more primitive technology now compared to ChatGPT. And because all healthcare professionals will rely on technology for information, because we can't store everything in our head. So yeah, it's a very interesting merger point of where like the old world and what we've been taught to do has now merged with the new world, and it's one now where the patients actually can have more leverage of information over the professionals, because we'll the patients and us on the ground will be more than comfortable with using ChatGPT, whereas the nurses and other clinicians are not allowed to, in a way. It's not, they're not instructed to. That's not part of the process. So yeah, big things are going to
Power,
change.
bro, I actually really thought about it and I was like, this is so powerful. Because for the first time, what happened was a non medical person was able to have leverage over a person who's been trained for how long, and was able to change the course of the
The
treatment.
trajectory of
And it didn't take this person long. Like she literally clicked the photo and said, tell me what this could be.
Yeah, yeah, it's powerful. And the good thing is, I think like what I'm assuming is on ChatGPT's end, it said this could be,
Yeah,
So
yeah, yeah.
I'm assuming, because what I've when I've used ChatGPT like this, it says this could be this, but please go to a medical professional. So that's the other end of the technology, where it's good that it can caveat like that. And
Fact.
then for people, for us as well, like just normal like patients, people on the ground, general public, that's how you got to look at it. You can't look at it as this is 100% certified this. So going hand in hand is where the real power comes in. One question I had is, where did they go on holiday? Because I need to avoid that place.
Oh man, she actually told me. I mean, it was local. It was actually
In the UK.
in the UK. Yeah, in the
Yeah,
countryside somewhere. In the
that's
countryside
interesting.
somewhere, and it was like, oh man, she did tell me the name of the place, but I totally
Somewhere
forgot.
in the UK.
They Airbnb'd a big, nice like home by the country and stayed there for 7 days. Everybody got bitten, but the mother actually ended up getting a severe infection.
Okay,
So
everyone got bitten.
so
Damn.
so that was really interesting. So what she used is an example of narrow intelligence, right? So she basically put it in ChatGPT,
Uh,
a photo, and it said, well, it could be this, like one input, one output.
I don't think so. Like, I'd say like if the app was Lyme detector app, and it's
Right,
all it did was detect if it had Lyme, is what I would personally see
right,
as
right, right.
intelligence. But the fact that she could put it on ChatGPT meant to me ChatGPT is just is general. That's how I see it.
So what would you say that is? Would that be classed as elements of AGI in it?
It is. I see that as elements of AGI, and like what I didn't touch on is, we have narrow intelligence, general intelligence, super intelligence. Within them, there's also levels. Like say with
Mm.
AGI, OpenAI published a tweet or an image, a paper where it had 5 different levels of AGI, and yeah, let me. Can I share photos with
Yeah,
you?
yeah, yeah, yeah. Share it,
Yeah.
share it.
Can I just paste it in here?
Can
Or
you actually press share and see
yeah,
if you can?
maybe yeah. I'll share my entire screen.
Yeah, yeah, you can. You can.
Yeah, sweet. So let me share. Bang. So even within AGI, there's different levels. So
Wow.
there's different levels of AGI. So we can have essentially narrow AI, where it's not quite generalizable yet. And then we can have emerging, competent, expert, virtuoso, and superhuman. And I think when this image was released, I think it was in 2023, and they were saying essentially all aspects of narrow AI have been like met, and with general AI, we're at this like level 2 stage um, of AGI. And there's also another image that was released by OpenAI. Let me pull that up, which goes into it again in a bit more simpler detail. So this is the OpenAI's 5 level definition of AGI that define it a bit more. And it's where we go from the chatbots, like the ChatGPT, to reasoning human level problems. So this could be like OpenAI's
Deep search.
O3, yeah, deep research, and the GPT-5 thinking model right now. And then we go to agents, like AI agents that we were talking about earlier, which is like the computer can actually do the tasks rather than tell you the information and you go ahead and do it. This is kind of where we're at right now, level
Mm,
3. And then it goes into innovators and organizational AI, which is where it will be able to, let's say that innovators is where it will be able to push forward the frontier of human knowledge, create new knowledge
mm,
for. And then organizational AIs is when it can come together and form its own like organization, like its own company in a way, and start affecting change on a broader scale. So yeah, so going back to your question, like, was using ChatGPT narrow or general intelligence? I'd say it's general intelligence, and it's here. It's like level 2 AGI. That's how I see it.
interesting. Interesting. Do you know what? I wasn't actually familiar with the fact that there was levels to AGI within the AGI.
Yeah, like it's not like a complete agreed upon thing from everyone. This is the thing. It's more like OpenAI said it, and it's not like a dictionary definition, but it's one that's
Mm,
quite useful in order to frame my thinking around it.
interesting. Interesting. When do you think ASI do you have like a personal timelines where you think that or predictions basically?
Actually, yes. Actually, I do. Yeah,
Give it
but
to me.
this is more like, yeah, this is kind of left field. This is not from like any expert. It's just my own brain, just like acting out. And I just feel like something crazy is going to happen by 2029. Something incredible is going to happen. I don't know why I can feel like this, but actually I do know why. It's because it's these are bringing together theories from multiple people across the world. So one is Ray Kurzweil, another one is Peter Russell, who talks about the global brain. There's a few more as well, but let's just stick with these two. Like, say Ray Kurzweil is he's a futurist. He's had a prediction that um, we are going to have artificial general intelligence, or I'd say super intelligence, by 2029. And he made this prediction in 1995, and everyone laughed at him. Everyone's like, "That's not going to happen." But then, as soon as time keeps going forward, it just seems like like it just seems like more accurate to the day. And I read his book. He's got one, his groundbreaking book in the past is called The Singularity is Near. I think that came out in 1995, but he has an updated version called The Singularity is Nearer that came out last year. And that book is incredible. Like, I read that book front to back last year. It's one of the few books that I fully read. And that's one reason why I think that. And then Peter Russell, he's also, I'm not sure what he is. Like, he's just like he's like,
Polymath.
yeah, he's just polymath type person. But he's got a theory called the global brain, where he talks about how what we're essentially doing is bringing together intelligence to form a higher intelligence. So like, I can go into it in a bit more detail if you want,
Yeah,
but
yeah, yeah, yeah. It sounds very interesting.
so it's going into the more like metaphysical type realm though. What he talks about is how, like, imagine like neurons, like a single neuron in the brain, right? You need billions. When you have billions of neurons, or trillions, even, I don't know how many, but they come together to form the higher level intelligence of the human
Yeah,
brain, right? And a
yeah,
single neuron on its own is like a micro intelligence. But then now what he's saying is the next level is that, imagine each human brain is like a neuron, where each human brain is like a micro intelligence. And what humans are doing is essentially connecting all human brains together to form another higher level intelligence. And um, I can see that happening, and it's happening right now with phones. What we're doing right now is using the internet to essentially like connect our brains together. And even now with AI, AI is just like it's like a manifestation of all human knowledge connected together. And this is why we talk about the singularity, and how by 2029 I feel like there's going to be some type of incredible breakthrough where everything that we're working towards comes together.
Do you think that's going to happen in the next 3 years?
Yeah, like 4 years, right? 2029.
I mean,
I
yeah,
feel like
25
I
is
just have
over,
a
but
hunch, like I have a
yeah.
hunch because I think there's other people as well. Like I think like Elon had a tweet where he randomly said 2029 as well. And it's just like, why am I seeing 2029? It's like that Jim Carrey movie when he sees the number 23 everywhere. I'm just seeing 2029 everywhere, and my brain's just like pattern recognizing something.
I mean, my bet is much, much further. And again, it's based on nothing but instincts in the sense that I don't think that it's not going to happen. I'm pretty sure it's going to happen. But the fact is that it needs to, like, again, like it will be the governments, it will be the regulatory people that are actually going to, control this. Like in the European Union, they're already doing it, like they're much more stricter compared to China and America. I personally think it's a bad thing. But I feel like if you're talking specifically about healthcare, that's the area where, ironically, will be the last to get impacted because it's so heavily regulated.
Yeah, it's interesting what you were talking about around the health area aspect of it. I agree. Like, I don't think it's a good idea for centralized bodies to have only have access to the super AIs and people cannot have access. I think it would be a lot better if people can have democratized access to
Yeah.
intelligent AIs. But, they will say like, oh, there's a risk now because then it means that a normal person might be able to jailbreak the AI and understand how to make anthrax from just like regular consumer goods that you buy in Sainsbury's or whatever. But it's like, I don't know, like, the internet can allow that, but it's complicated. But I think the benefits will far outweigh the cons. But it does touch on actually going back to what we were talking about with like the regulatory bodies and NICE and MHRA and FDA and World Health Organization and how are they going to function in the world coming forward? And it might be that maybe they will be the ones that will use the super intelligence first and
Mm.
in access to the whatever information they need to be able to form the necessary guidelines that they will make, rather than people having access to it first. So instead of them, I feel like the only way that they can catch up is if they integrate AI into how they currently, their current processes for creating regulation and guidelines.
I just don't really see any kind of signs, from any governing body to say that we actually recognize this is happening. Especially, let's just say you turn out to be right and it's happening in 2029. I think these agencies are just not ready for it. And
Yeah.
and even like regulatory authorities below them, like there are like so many associations, like Liver has its own British some association, for instance, HIV has their own, Renal has their own, like these are governing bodies too. And when you actually speak to people, I don't think anyone is really talking about AI in the way,
Yeah.
in the urgency that I think people should talk about it.
That's it. I think it's going to take a crisis, like another COVID type crisis, because we saw that when COVID happened, how quickly did regulatory bodies come together to create the vaccine? That
Yeah.
was created in world record time. That would have been not possible if COVID hadn't happened. So
Yeah,
then
yeah,
that
yeah.
just shows, like when there is backs to the wall, the body, like the national and global bodies, can actually do stuff really quickly.
Yeah.
And so that might be what it takes to them to be like, okay, we need to use AI ASAP.
It's always a crisis. It's
Yeah,
always a crisis that actually
the
gets
forcing
people moving
function.
and reducing the red tapes, basically.
Yeah, the
You know what?
forcing.
Yeah. So let's move on with the topics. I mean, we've been speaking for quite a long time now. Now, I don't know if you want to like skip the case study that we spoke about and go straight to like viewers' questions, and then maybe discuss it the next week. I don't know what you think about Clarity,
Yeah.
discussing Clarity today.
So we had this idea of the case study where Clarity is the first FDA authorized AI platform that can predict women's
Breast
future risk
cancer.
of developing breast cancer. Thinking about it though, it's similar to what we were looking at before with the
Yeah.
ovarian podcast, where it's like it's the same kind of questions that come up for me. It's like this is a no brainer. The
Yeah.
only things is when we're actually talking about implementing it, does it come to cost and
Yeah.
testing the tests. So I think it's kind of similar, you know. So I don't know.
Yeah,
I
yeah,
wouldn't really have
yeah.
anything
Let me
additional.
just let me actually quickly add like one bit to it, and maybe not discuss it into details, because we were just ironically criticizing all these governing bodies to say, are they going to put their acts together or not? But for this, I'll probably eat my words, because Clarity, this
Should we
startup.
put it on screen?
Yeah, yeah, yeah. Let me just
I can
see if
share.
I.
I can share.
Yeah, yeah, yeah. Share it.
Yeah.
So while share it first, and then I'll explain.
So clarity, yeah.
Mm-hmm. Spelled with an I. See, oh yeah, this is it. That's
Clarity.
it. So Clarity, this is basically a Boston-based digital health company, which was founded in 2020 by Dr. Constant Lehman, a Harvard radiology professor and breast imaging specialist from Massachusetts General Hospital. And what this does is that, unlike traditional models that rely on age, family history, or self-reported questionnaires, their model called Clarity Breast basically tells you your 5-year risk of getting a breast cancer just based on mammogram images. Like literally, your mammogram image is going to be fed into this beast or this model, and it's actually going to tell you what your risk of the next 5 years is going to be. And based on that, you can actually make earlier interventions. So again, this could actually save God knows how many lives. But unlike what we're talking about, is it going to be implemented or not implemented? Like FDA must have seen enough evidence to say this is much better than humans. And this becomes the first AI model to be authorized by FDA.
Yeah, it's interesting. I wonder, does it only use mammograms, or it must use, like, what else is in the AI model? Is it an AI model that's just been trained on millions, billions of mammogram images, so it's able to um like have a really like
So
rely.
basically, it says that it was trained and validated on data from diverse population, and over 77,000 mammogram across multiple screening centers were used to train the data.
Interesting. So, yeah, it'd be interesting to know what other information would it use, because it's predicting a 5-year risk here. And then does it mean that it will look into the age and like the ethnicity and where the person lives? Does it have all of that data as well? Um, that
Well,
would
I
be.
would imagine. I would imagine that that's the data that you would actually put it in, right? You would actually put it in the model to say this is a female, 53-year-old Asian female, and this is the mammogram thing, and then it's going to come out and say, well, based on what the information you've given us, this is the risk for 5 years.
Yeah, yeah.
Um,
Or does
which
it just purely use the mammogram scan? That'd be interesting to see. Interesting here though, it says it does not detect or diagnose. So I feel like, is that a caveat that they put in just for some reason?
yeah,
Because yeah,
yeah, I mean, I don't want to speak on their behalf, but I think the entire aim is to find a preventative measure as opposed to focus on diagnosing and detection, right?
yeah. Well, surely if it's an AI that's been trained on millions of mammograms, surely it's like the ultimate tool for detecting and diagnosing breast cancer. That's how I'm seeing it. But then, yeah, I'm not sure why they'd say it doesn't diagnose it, because for me, it seems like that's the first thing that you'd use an AI trained on mammograms to do.
Interesting. But then again, would you want the preventative risk measure, getting it done first rather than bringing in the diagnosis tools first?
Right. Yeah. Yeah. So then I guess is the aim for people who
A
haven't
higher
had
risk.
symptoms, that people who haven't had any kind of symptoms yet,
Yes.
haven't found
But
anything or anything like that. You use
exactly.
the scan now, like way, way before.
Yeah.
And yeah, so that's crazy that somehow that they'll be able to find the 5-year risk on that.
Exactly. And I think whenever it comes to cancer, you're really talking about reducing the late stage diagnosis, right? And
Mm.
and improving the outcome. So what this is saying is that it's actually going to find out the early risk prediction, and let's just say the prediction score is very high, then well, then the person can actually intervene, or the cancer team can actually intervene much earlier to see, okay, what are the measures to actually improve the outcomes. That's the way I look at it.
Yeah.
So
Yeah. I mean, it's opening up a load of questions. Like, say if it's for like someone who has no symptoms and it's purely for preventatory reasons, and then they'll take the Clarity AI scan and it says, in the next 5 years, you have a high risk of developing breast cancer, but you don't
yeah,
actually have it right now. What do
yes.
you do? What is the treatment? Because you don't even actually have it.
I mean, that's a question for an oncologist. But like, imagine what you do when you measure the cardiovascular risk of somebody. So if you find out that your cardiovascular risk is more than 10%, that is classed as much higher of getting a risk of heart attack or stroke in the next 10 years, right? So what do? You actually modify your behavior, right? You get onto the statins, you try and lose weight, you cut down, processed food, lose
Yeah.
weight, like stuff like that. So
Can you
I'm
do that for
sure,
breast cancer though? You can't do any preventatory behavioral things for breast cancer. I don't know.
no, I mean, well, what I would do is you actually, again, I don't want to speak for oncologists, but I would imagine that you would do more regular follow up,
I
right?
see. Yeah.
In the next years to go, to actually keep detecting, to say, well, is it, does it exist or not, or is it something that you can do like gene therapy first? Like, could it be like gene related? I mean, I'm really speculating, but the fact
Yeah.
is, if a tool tells me that for a woman to get breast cancer, you have a 50% risk or a 40% risk, I'm sure like there will be some kind of measures that the doctors could do to
Yeah.
prevent that from actually getting into that stage where you want to use chemotherapy, if you know what I mean.
Yeah. Yeah. I mean, let's not forget, like breast cancer can happen in men. Like it is possible in men, so it's not ruled
But
out. But
no, of
it's
course.
also famous Angelina Jolie, right? She got a
Yeah,
mastectomy,
yeah, yeah, yeah.
and I
Yeah.
think that was because she had the BRCA scan, and it said
Yeah.
that she was at high risk of getting it, even though she didn't have it yet. I believe.
Mm,
So that was a preventative mastectomy.
there you go.
Um, so that's interesting, interesting.
That could be a lot, that could be one of the things that can actually come out of it. Right, cool, bro. Let's just move on to the last section of the podcast, which is where I asked some listeners some Q&A to say that, look, we're discussing AI in healthcare. Do you have any questions you would like to discuss? And I got some really interesting ones. Let's just try and see if we can have a quick discussion on a couple of them. So the first one is, would you trust AI to give you a diagnosis before doctor sees you? What do you think, Dean?
For me personally, it was I was saying here 100%. Like I'm already doing that, and what you're saying already with the story about the Lyme disease, like like when I'm thinking about say like our role as pharmacists, what's been a big push recently from the NHS is telling the general public to go and see a pharmacist before you go see the doctor, before you go see the GP. But now it's like you can use the AI before you go and see the pharmacist, which is you use before you go and see the GP. So it's like another safety net that's been added like the list of safety nets. And you've got the very first one, which is free and easy to use, which is AI. And it's important though to look at it as step one, like gate number one, before you go to gate number two. And it's true. Like there's a lot of people though. There's some people that I remember seeing when I was a pharmacist, where they're kind of hypochondriacs. They'll actually have a cold. They'll have the sniffles, but they'll go in and see the pharmacist or go see the GP or even sometimes go into hospital because they're going to A&E because they're worried, which is understandable. But it turns out the whole time that they have a cold or something simple. It's all just a general thing. Like so having like an initial, as I would imagine, having a patient having that initial barrier where I speak to an AI, it could be better where they could be like, go to the pharmacist, don't need to go to A&E straight away. But it would help give that calmness. It would help remove stress. That's how I see it. What about you?
Yeah. Well, I think if you were to think of first principles, right? All you need is a correct diagnosis. Does it really matter it comes from another human being, or does it matter that it comes from a computer screen, right?
Mm,
I mean, back in the day, like you used to get a letter to say your test results have come back. Unfortunately, you have this. So essentially, a, a piece of paper gave you a diagnosis when you think about it,
Yeah.
right? And then you spoke to a doctor. Or sometimes you could have a results line where there is a person who sat in a sexual health clinic, for instance, and their job is to just give you diagnosis. So that's not necessarily a doctor. So we have been getting diagnosis from different ways, generally speaking, but it just seems to happen that, whether it's a pharmacist, whether it's a nurse, whether it's a healthcare professional, like we're just so used to our brain is designed to just think that, it has to be a human to give a convincing diagnosis. But the truth is, a lot of times there are cases of misdiagnosis, right? So at the end of the day, what would matter is who is giving you the correct diagnosis.
Yeah.
Nothing else matters. Nothing
Yeah.
else matters.
Yeah.
So to me, yes, I would I would trust an AI. If you can show me a model that is known to beat humans, I would actually trust that model. You know,
Yeah. That makes
and
sense.
And luckily, what we have is we have choices. Like I don't think that it's going to be, oh, this is one model for kidneys. You might have five of them, right? So imagine you can actually put in your data in five of them and they will all be cost effective, right? Human beings, you can't actually have five kidney doctors and each patient is being seen by those five kidney consultants. That doesn't happen. They all have their own cohort of patients, whereas you can actually have five models who are as intelligent as a doctor and they can both come up with a consensus diagnosis. Imagine that, right?
Yeah. That's powerful. That's
So
talking.
yeah.
Yeah. So maybe we'll talk about it next week about what you're just saying there about having a consensus. There's an AI that Microsoft have created, but we'll talk about it next week.
Yeah. Let's actually talk about it next week. Okay, next question. Oh, this is funny one. If AI gave you different advice than your doctor, who would you believe?
Yeah, it's very dependent. The other thing is, if you're listening to this, let us know what you would answer in the comments. Also,
Drop it in the comments. That's
yeah,
right.
it's very dependent. There depends what it is because, like what you were saying is, if it's like a physical illness where it's like you just need a blood test or something that's very quantifiable to get the diagnosis, and it makes a lot more sense to trust an AI, especially if it's got experimental evidence that is more accurate. Then when it's health is huge and it's getting into the realms of, say, if it's something that is mental health, and you can't always get the judgment from data that we have quantifiable because it relies on things, subtle signals, like patient tone and how they speak and the way that their mannerisms are that humans can or like say like a mental health specialists could identify, but you can't put that into data that an AI can look at yet. So I would say right now it depends. That's the answer. It depends on what it is. I would the things where I'm at right now is I'm fortunate enough not to have any kind of medical conditions or
Yeah,
illness.
yeah, yeah,
So
yeah,
I'm in the
yeah.
place of right now when I use AI in health, it's more around getting information about supplements, dietary intake, protein intakes. So I think that I'm just using AI because as doctors and pharmacists, we barely got any training in nutrition. We don't have that much at all. So yeah, right now I'm personally using AI. But what would you do?
I thought about this, and you know what my brain said? It would all depend on credentials. Right? So, what do I mean by credentials? So, somebody asked this question in a podcast that who would you believe if an AI model passes a bar exam in law and has actually proven that this model can efficiently argue the cases within a particular realm and it has a certificate by the bar. So imagine the same analogy, but in healthcare. Imagine a model that actually has passed MBBS, like medicine. It has gone through all the exams, it has done everything you would expect that human doctor to go through Imagine this model has done it too, right? Whereas on the other hand, you have a doctor who's just qualified. So I think nuances is very important here. Is like, who are you believing? You can't really like whoever asked this question is actually saying that a doctor is somebody who's incredibly senior, and then you've got a model which is just like a model. But my thing would be, what are the nuances here? Right? Is this a general practitioner and you're asking a cancer diagnosis, for instance? Or it is somebody who is into oncology consultant and you're talking about a general model. So credentials matter, is what I would say, whether it's a human or an AI model. But obviously, right now, as you're saying, you are very likely to go to your doctor. But to be honest, once these models starts to come out, like Clarity has given you a glimpse of what could happen. So I don't think you would have a doctor who has seen 77,000 mammogram photos and able to memorize it. Do you know what I mean? So suddenly I'm more likely to believe that model now. And I'm really thinking out loud here. But on the other hand, you could tell me, okay, would you believe this model or would you believe the world's best breast cancer surgeon who's actually worked in all 5 or 6 continents and has got over 40 years experience? I will be more inclined to go there. So I think it's all a game of credentials for me. Like
Yeah.
like who is this doctor, and what data is this model trained on? And based on that, I will tell you who I believe.
Yeah, it's interesting because what the question you were saying, like a human wouldn't be able to have memorized 77,000 mammograms, but actually, like say there's a breast cancer specialist doctor that's has 40 years expertise. In a way, they could have memorized 77,000, not memorized in the like photographic sense, but in terms of deep intuition. So
Yeah.
maybe the best in the world expert has something that the AI doesn't know. Maybe that's
Maybe,
what I'm thinking.
maybe. But
So cool.
just to throw it back, like maybe that doctor on that day is having a very bad day. That genius doctor maybe didn't have a lot of sleep last night or got a life-changing news about his wife or son. Like he's actually emotionally not there, right? So how do you account for that when you actually think
Yeah,
about it?
yeah, that's true.
Nuances really matter with this. So it sounds very straightforward, but this question is not that straightforward, as far as I would say. Do you want to go through 2 more, or should we just wrap it up? We've been talking for quite a long time, bro.
Let's do one more.
One more? Okay. You choose. I mean, I actually
Yeah,
sent you
yeah.
the other 2.
I think let's say, would you trust an AI chatbot with your personal health history?
Ooh. Shall I go first?
Yeah.
Well, as long as it's not Chinese, I'm okay. I mean,
The
sorry.
Chinese models are open source though. So
Huh?
the Chinese
That's
models
true.
are open
That's
source.
true.
So I actually trust them more.
Yeah, yeah, yeah. That's a very good point. Like this is crazy. The West has closed source models, and the open
Yeah,
source model is actually coming from China, which is
yeah. You know
it
why
should
though?
be.
You know why?
Huh?
Have you ever thought about why? Why is that happening?
Well, why? I mean, my hunch about that would be, I mean, this is like digressing from the topic, but a summary would be that this is to devalue the West's progress.
Yeah,
The way West is running away with AI. What China did with DeepSeek is you open source the entire thing so that the value of
its power.
whatever the value that they were accruing, the Western world is actually, I mean, it was gone. Like, what wasn't it, like stock dropped by like 20-30% of all these companies in a day when that model was released? But yeah, that's like my thinking. Like, that's why that's
Yeah.
happening.
So let's say the question is, would you trust ChatGPT, the
Okay.
closed model, with your
Okay.
personal health history? Or like Google Gemini, or like a closed, or Claude, like a closed
Yeah.
source?
Yeah. The premise of this question to me is whoever's asking this question thinks that our data is currently protected. That's the way I look at it. So, what's really interesting is that in the healthcare world, in the NHS, we have our data sat on the server of a private company like Cerna, Epic, you can just name it. And these are like private American companies that say that our data is protected, right? Now the question is, should you believe it? And first principles thinking to me basically says that their number one role in the capitalist 101 is to maximize shareholders' value and actually work for profit, right? I don't think it is patient care. It's patient care as long as they're making money. So on a private company, that's where we actually input all the data. So I think the best thing to, for me at least, to accept that maybe our data is not protected in the first place.
Mm.
And it protected, not protected, do I have access to it? If I right now want to check what was my blood test result last year, I can't go on to Cerna and actually check. There is no app that's telling me, this is what the scan showed. So this
Yeah.
entire thing of data safety, like what does that even mean? And do we have any idea what is currently happening with our data? I have no idea.
Yeah.
And are there back channels where Cerna, Epic can actually at least look at that data, maybe not steal it, but actually are they using that data in a way to come up with products and stuff that are actually being used on us? Like I have
Yeah.
no
You don't know. Yeah.
I have no transparency, right? So what's happening is this is one world where they might be using my data, but I'm not benefiting from it at all, right? To now you're actually saying that should you actually put your data into ChatGPT, well, you get instant results back with the ChatGPT stuff. Right? Whatever you're putting into ChatGPT, you're actually um in your profile, you can actually save that, right? It is learning. Now, I'm not really advocating, by the way, people should make their own mind and stuff, but I really keep thinking about like, what does it even mean that my data is protected when it's currently sitting, under the national health banner, but it is still sitting on a private company's server. Do you know what I mean? So how different is that to me putting into ChatGPT and saying, can you actually tell me what this data means?
It's a really good point. Really good point. I'm kind of in a similar ball camp to you, but that's opened my mind up a bit more. I didn't think of it like that. Yeah, I guess like the thing is, we're not even allowed to check our own health records. With the NHS smart cards and going on, we're not even allowed to look at our own records. So yeah, but there are still laws in place. Like in Europe, especially, you've got GDPR. So it's like a mechanism to help protect data, but it can only like try in a way. It can't guarantee that data is protected. It is useful for us, but at the end of the day, the data is still on a centralized server, which means that even if the companies want to protect it, even if they try, it's still a honeypot for
Yeah.
hacking, and it
Yeah,
can
yeah, yeah.
it can get hacked even if they try not to. So I think about this when I think about that. Like before that, anyway, I'm putting my data into ChatGPT because, like you're saying, you can get insights. I'm getting great health insights. I had my DNA data. I put into
You mentioned
ChatGPT,
that. You mentioned that.
found that I was
Yeah.
lactose intolerant. It
Yeah.
located the exact gene where it said you have mild lactose intolerance. So yeah, that's great. That was fantastic. ChatGPT is in the same area here where they have a centralized server, which is a honeypot. So even if they try and protect your data, they might not be able to. The other thing though with ChatGPT is that, well, like OpenAI, for example, is like they're not making that. I don't know if this is a fact or not, but I'm reading in the news like they're not making enough money. They need to make money, and it reminds me of how Google, way back when it began, was in the same ballpark where they needed to make money. So that's where they started selling people's data, and the whole advertising revenue
Revenue started
came from
coming
that, and it
in.
really changed the internet. So I hope like OpenAI don't do that. But to be honest, I don't think that there's anything really stopping them from doing
Yeah.
it. As long as the data is like de-identifiable, they could use it to train. But personally, I don't actually have a problem as long as it's not identified and identifiable. And another opinion I have is that I don't actually think most people around the world care, because if people really cared about privacy, No one would have a Facebook account. No one would have an
Yeah.
Instagram account, but everyone
Yeah.
does. People like
Yeah.
to say, like, I care about privacy, but at the end of the day, like, I don't know how much you really do. Yeah, the way I want to end is that, so we're talking about all the data is on a centralized server, and there's a whole other area of disruptive technology around the blockchain and the Web3 world, where it's all about decentralizing the data, decentralizing everything. So my future vision is that we will be able to access and own our own healthcare data that is on a decentralized system, which is not kept in a centralized server that's a honeypot for attackers. And then we will be able to decide who is accessing our data, and we could even get paid for that. And that's the vision of the future.
Truly decentralized service. Exactly. Like right now, I mean, look, I think not half, I think 90% of the people would not be able to explain what GDPR is, by the way.
Yeah.
And, it is such a curtain. Uh, Wales just been, put in front of us to actually say, oh, don't worry, your data is protected. Your data is protected. Well, I don't have access to my data. Do you know what I mean? So what am I actually getting out of this data protection? Look, by the way, I'm not naive. I know there are huge risks. AI can be used for, bioweapons and all sorts of stuff. And, all they need for that is data. I understand all of that. But what I'm saying is, and I think what you're alluding to as well, that can already happen through hacking. Yeah, but make up your own mind. We don't obviously recommend that you should put all your data on ChatGPT, or no one's encouraging or endorsing it, but we're just thinking it out loud to say that, what does data privacy even mean? Is our data protected? We're literally just taking somebody's word for it, to be honest, and hoping that that would be the case. Whereas it's not really beneficial to us, not when our appointments are happening every 6 months, 10 months, 12 months. That's when we just get shown a glimpse of it. This is what your results are. And then you're gone in 10 minutes. And then it's not in your hand. So, I mean, okay, I think this might be a good place to end, Dean. I think this was another fascinating discussion. I think the fact was it was kind of off script, and we literally just, our brains run wild.
That's how I like
Let
it.
us Yeah, yeah, yeah. Let us know in the comments. Let us know in the comments, what would you do? Would you trust AI with your diagnosis? Or would you want a doctor to give you a diagnosis, or everything that we discuss? And if you do want to ask us any questions for next week's, do drop it down in the comments. But for now, for Dean and for me, stay safe, guys.
Yeah. If you made it this far to the end of the podcast, I appreciate you. And yeah, any feedback, any advice, any questions for how you could improve, or how we could improve it for next time, let us know. Peace.
Yes, sir. Take care, bro. Stop recording.